1 in 5 adults in America have mental illness, yet only 40% received care in the last year. 20% of all children ages 13 to 18 live with a mental health condition. Half of all lifetime cases of mental illness begin by the age of 14 and 75% by the age of 24. And yet, the average delay between onset of symptoms and intervention is between 8 and 10 years. 8 and 10 years. Half of these children will drop out of high school. Mental illness is an economic crisis. In America alone, serious mental illness cost $193.2 billion in lost earnings every year. Almost every child who drops out of high school because of mental illness have been robbed of their chance for a healthy and financially independent life. This won't happen without many, many calls by not only the advocates in this room, but you come in contact with people every day that might have a family member, a friend, a husband, or a wife. We need you to call Governor Cuomo and say, sign this bill and sign it now. We've worked long and hard over the years. Glenn Liebman has been phenomenal. People wrote letters. I heard from family members, and the time is now, and I need all of your help.
We know that 1 in 5 people, as Assemblywoman Gunther said, 1 in 5 people in this country are impacted directly by mental health related issues in the course of a year. If you add family members like myself, close friends, we're all impacted. There's nobody I know of who's either not directly or indirectly impacted by mental health related issues. And yet, for several reasons, led by stigma, people do not seek services. As Assemblywoman Gunther said, 10-year gap. Can you imagine any other illness where there's a 10-year gap between onset and actually seeking services? And when you ask, and when you're surveyed about that, when people are surveyed about that, what do they say the number one reason is? Stigma. It's all about stigma. In one word, it's discrimination, it's stigma, because the reality is that people recover and move forward in their lives. If they receive treatment early, if there's early intervention in place, if there's preventative services in place, people will get better sooner. We don't have to worry about all the psychiatric disability, and we don't have to fight the stigma constantly that we fight every day in terms of when we're advocating for resources, when we're advocating for funding. It's always about, well, you know, people with mental illness are violent, they're crazy, they do wild things, and that impacts public policy, that impacts everything we do, when in reality we know none of that is true.